in partnership with the Maryland Office of Preparedness and Response within our state's health department. We provide emergency preparedness education, training, and resources to home and community-based healthcare providers, patients, and their caregivers. I'd like to extend my gratitude to Executive Director Caitlin Hauk of Minka, who's with us on the call today, and to the staff at OPNR in our state health department for their ongoing support. Your invaluable partnership is what makes this work possible, so we thank you. I am incredibly excited to introduce our guest, but before I do so, I'd like to cover a few housekeeping items. As for the recording, today's webinar will be recorded. You can expect to receive the link to the recording following the event. Additionally, it will be made publicly available both on our website and on our YouTube channel. As for the audio and camera portion of today's event, you will have complete control over your microphone and camera settings. While we kindly request that participants remain muted during the speaker's presentation, we do encourage active participation, so we invite you to come on and unmute during the interactive segments of today's event, such as the Q&A. Additionally, attendees are warmly invited to activate your camera to connect with us today, though it is not required. As for the Q&A, we encourage questions, so please submit them into the chat box. It will be monitored throughout the presentation, and a special segment towards the end will be dedicated to your questions. Last but not least, I am finally thrilled to introduce our guests. With us today, we have Diane Kashak from the Maryland Department of Health Project Firstline. Project Firstline is an innovative outreach program developed in partnership with the Center of Disease Control and Prevention, designed to promote foundational knowledge on infection prevention and control for all types of frontline health workers across Maryland. As we enter this respiratory season, Diane will guide us through a presentation that will support our infection control preparations. Diane, I am handing the floor over to you.
Thank you so much, Kendall and Caitlin. Good afternoon, everyone, and thank you for attending this EPN webinar as I present information from Maryland Project Firstline on infection control training topics. Thank you especially to EPN for hosting this important webinar. My name is Diane Kashak, and I work for Health Quality Innovators. The Maryland Department of Health contracted with HQI to roll out the CDC's Project Firstline initiative, which is a free infection control training program offered to all healthcare worker communities and their healthcare staff and environmental service workers who work in the state of Maryland. As part of Project Firstline training, I will be reviewing some basic principles about infection control that will help protect you, your colleagues, residents, patients, and families in your community and work environment. This information is provided as a PowerPoint presentation, which also includes a series of videos narrated by Dr. Abby Carlson. Dr. Carlson is an infectious disease doctor that will be presenting these concepts. Just to let you know, this information was provided and initiated during COVID-19. Some of the information may seem as though it's old, but it is the up-to-date information that we have regarding COVID-19 and some respiratory viruses. I will now begin with our presentation.
Okay. Okay.
Project Firstline, the concept of infection control. Our agenda for today, we'll talk about the concept of infection control for topic 1, and that has one video. We will then move on to the basic science of viruses, which contains 3 videos talking about different things related to SARS-CoV-2 and COVID-19. What's a virus and how do viruses make you sick? We will then talk about topic 3, how respiratory droplets spread COVID-19, and move on finally to topic 4 about how viruses spread to people. I'll do an overall review at the end. Next slide, please. The learning objectives for topic 1. The concept of infection control is to be able to articulate at least one primary goal of infection control. We will now begin with our first video. What is the goal of infection control? Kendall, I don't hear the volume on the video.
Okay, I'm going to troubleshoot this now. Let's begin again. Thank you for your patience.
Hello, everyone.
There you go.
I'm an infectious diseases doctor here at the Centers for Disease Control and Prevention in Atlanta, Georgia. And welcome to Project Firstline's new video blog. On this blog, we are going to be explaining some of the basic ideas behind infection control, why they work for COVID-19, and then how they work to protect you and your patients, your coworkers, and your community. To start off with a little bit about myself, up until a few months ago, I, like many of you, was working in a hospital. I was part of an infection control team, and I was also working as a doctor, caring for patients. And as you know, it's been almost a year now since the beginning of this pandemic. For those of us in healthcare, it has been a year filled with a lot of change and a lot of challenges. We've encountered situations that were seemingly impossible. They were new, they were stressful, and quite frankly, they were scary and traumatic. We're doing so many things differently now because of COVID-19, from screening patients and employees at the entrances to wearing masks all the time when we're at work. These changes can be overwhelming to all of us. And we may not always understand why we're doing certain things that we're doing or why those things matter for stopping the spread of the pandemic. Let's be honest, there are a lot of infection control recommendations for COVID-19. There is a lot to do, and it is really important that we do it right. We here at Project Firstline are here to help with that. We want you to understand not just what you're doing to control COVID-19, but really why you're doing it. That's because we believe that you can do your job best when you understand why you're doing what you're doing. So before we get into the why, it helps to first think about what we're trying to do with infection control. The ultimate goal of everything we do in infection control for any disease is to keep people from getting sick. In this case, to keep people from getting sick with COVID-19. Obviously, we don't want our patients to get sick when they come to see us for care, but it's equally as important that they don't make us sick as we're providing care. And just as importantly, we don't want to make our colleagues and coworkers sick as we work together. We want this to be a safe process for all. We're in healthcare because we want to help people. That job is more important now than ever. And we all recognize that there's some risk of infection in going to work during a pandemic. So the goal of CDC's infection control recommendations is to protect you and everyone in the healthcare facility from getting infected while you're making sure your patients have the essential care that they need. And our goal here at Project Firstline is to make sure that you have the infection control knowledge that you need and deserve to keep yourself, your patients, your colleagues, and your community safe. In our next video, we're going to be discussing SARS-CoV-2 and COVID-19, two terms that we hear a lot, but we don't always know what the difference is between the two of them. So we're going to go into that in our next video blog. Please be sure to follow us on Facebook and Twitter to get our updates, or check us out on the web at cdc.gov/Project Firstline. We'll see you all with the next episode.
Okay.
The key messages for topic 1. The goal of everything we do in infection control, as Dr. Carlson said, for any disease is to keep people from getting sick. The goal of Project Firstline is to make sure you have the infection control knowledge that you need and deserve to keep yourself, your staff, colleagues, patients, and families in your community safe. We're here to help you understand not just why we're doing and what we're doing to control COVID-19 and other diseases in healthcare, but why we're doing it. Next slide, please. The learning objectives for topic 2. Topic 2, the basic science of viruses. Differentiate one core difference between SARS-CoV-2 and COVID-19. Identify and learn about the 3 main parts of a virus. Understand how viruses use cells of living things to make more copies of themselves. And finally, explain one reason why infection control actions focus on keeping respiratory droplets out of the air and away from other people. Next slide. We will now listen to Dr. Carlson as she discusses the difference between SARS-CoV-2 and COVID-19.
Hi, everyone. I'm Abby Carlson. I'm an infectious diseases doctor here at the Centers for Disease Control and Prevention in Atlanta, Georgia. Welcome back to Inside Infection Control, our new blog from Project Firstline. We are going to clear up today a difference that you see a lot, which is these two terms, SARS-CoV-2 and COVID-19, and understanding what those mean. We see these terms in many places in healthcare, and a lot of people have questions because it's not always completely clear what the relationship is between the two. So we're going to clarify that. SARS-CoV-2 is the name of the virus, the official scientific name of the germ that causes the disease, COVID-19. This can be really confusing, but it's actually not all that unusual. There are other times in medicine where a virus has one name and the disease that causes it is named something else. One example that you all might be more familiar with is chickenpox. Chickenpox, the disease, is that rash that you maybe got in childhood or maybe you got vaccinated against it. But the virus that causes chickenpox, the disease, is named varicella-zoster virus. That's its official scientific name. So similarly, because SARS-CoV-2 is the official scientific name of the virus that causes COVID-19, when we talk about the virus and what it does in the body to make people sick, we use its official name. The places you'll probably see this most in healthcare is in testing and test results, where those results are often recorded by that official scientific name of SARS-CoV-2. You might also see it a little when people talk about the vaccine. On the other hand, COVID-19 stands for Coronavirus Disease 2019, COVID-2019. It's the illness that people come down with. The fever, the chills, the cough, the difficulty breathing, all those other symptoms that people have when they're infected with the virus. So COVID-19 is the disease, those symptoms that you come down with, and it's how we mostly talk about the pandemic. So to sum it up, we get infected with SARS-CoV-2, which makes us get sick with the disease COVID-19. But obviously, we don't want to get infected and we don't want to get sick and we don't want to spread it to others. And that is where infection control comes in. If you're wondering at this point, well, what's a virus? Come back for the next episode. We're going to talk more about that and then why that matters for infection control in healthcare. As always, don't hesitate to follow us on Facebook or Twitter and check out our website at cdc.gov/Project Firstline. We'll see you all with the next episode.
The key messages for topic 2, as Dr. Carlson said, SARS-CoV-2 is the official scientific name of the virus. It's the germ that causes the disease COVID-19. On the other hand, COVID-19 is the name of the disease, the actual name of the disease. And when you have that, you have the fever, cough, chills, and other symptoms that people often have when they are infected with the virus SARS-CoV-2. Next slide. Now, Dr. Carlson will discuss and explain what's a virus.
Hello, everyone. I'm Abby Carlson. I am an infectious diseases doctor here at the Centers for Disease Control and Prevention in Atlanta, Georgia. And today we are going to talk about viruses. We talk about viruses a lot in healthcare, but people often have questions like, what exactly is a virus? What does it look like? How does it work? When you know a little bit about viruses, we can understand why certain things we do in infection control work to stop them from spreading and from making people sick. And even if you're already pretty familiar with viruses, you may need a way to explain it to other people when they ask you questions. So we're going to help with that. Let's talk a bit about the basics. Viruses are one of the many types of germs that make us sick, but we're talking specifically about viruses because the disease, COVID-19, is caused by SARS-CoV-2, a virus. It is a new virus in a family called coronaviruses. And that's why we talk about COVID-19 as coronavirus disease, because this new virus belongs to that family. Viruses aren't really a living thing like an animal is, and this is a big topic of debate, and we don't have time right now to talk about it on this video, but they are able to use living things like animals and people to make copies of themselves, and then they keep spreading from one living thing to another. Viruses actually only have a couple of parts. All viruses have genes, just like we have genes, and those genes contain all the information needed to make more virus copies. You can think of these genes like an instruction booklet or the blueprint of the virus. They're the thing that needs to be read in order to make more viruses. Viruses also have proteins, again, just like we have proteins. Most of the proteins in a virus come together to create a shell. The technical name for this is a capsid. And that shell protects those blueprint genes from getting damaged. Some proteins stay inside the shell and they only come out when it's time to make more copies of the virus. Other proteins stick out from the shell, and those proteins are special because they help the virus get around the body and also from one person to another. Some viruses, not all, but SARS-CoV-2 is one of them. Some have another layer on the outside of that shell called an envelope. And this is just like the envelope in the mail that protects the letter inside of it. The envelope for the virus protects the genes inside of it. And it is made of some fats with some protein mixed in. It also, like the shell, has some proteins sticking out of it. And just the same as the shell, those proteins are used to help the virus get around the body and help it get from one person to another. So we'll talk about this fatty envelope again when we talk about hand hygiene and environmental cleaning, because with cleaning, we destroy that envelope protecting the virus and prevent it from making more copies of itself, which prevents it from spreading. So now that we know what a virus is, we can talk a little bit more about how it travels between people and makes us sick, which can help us understand what we need to do in infection control to stop this from happening. We'll cover all of that in the next episode. So be sure to follow up with us on Facebook or Twitter. On Facebook, we have in the comments a picture of a virus that can help you follow along with each of these parts that we've described. And we'll be giving out new notifications of new episodes as they're released. So check us out there online at cdc.gov/Project Firstline, and we will see you with the next episode. Bye, everybody.
Let's review the key messages for what's a virus. As Dr. Carlson said, all viruses have two parts, genes and proteins. The genes contain all the information needed to make more virus copies of the virus. The proteins protect the genes and help the virus spread. Some viruses, not all as mentioned, but SARS-CoV-2 is one of them that has a third part, and that is called the envelope, and it is made of special fats that protect the genes and proteins. Next, we will listen to Dr. Carlson as she discusses how do viruses make you sick.
Hi, everyone. I'm Abby Carlson. I'm an infectious diseases doctor at the Centers for Disease Control and Prevention here in Atlanta, Georgia. We are continuing our infection control series, our Inside Infection Control video series today from Project Firstline, and we're going to talk more about viruses, specifically how viruses make us sick. The things that we do for infection control for COVID-19 are all to keep the virus that causes COVID-19, SARS-CoV-2, from getting into our eyes, nose, and mouth, or someone else's, where it can make us sick. But a question that you might have is, well, how does that happen? What does a virus do when it gets into the body to make us feel sick? Knowing a little more about how viruses work helps to understand the things that we do for infection control. We talked in another earlier episode about the parts of a virus. If you haven't seen that episode yet, please do go check it out when you're done here. But today we're going to talk about how viruses are able to use cells in living things, including people, to make more copies of themselves to spread within the body and to move from person to person. So our bodies have billions of cells. They are like microscopic building blocks. Our cells are very different from viruses, but they do have some things in common. And one of those things is that they have little parts made out of protein that stick out of the surface of the cell, just like a virus has proteins that stick out of the surface of the virus. And some of those little parts that stick on the outside of the cell, they work like a lock on a door. If you have a key to that lock, you can get into the cell. If you don't have a key, you can't get in. But viruses that can make us sick have found a way to make a false key, a little part that sticks out from the surface of the virus that will fit into a lock on at least one type of our cells. It's not an exact match, but it's close enough that the virus can hack in and invade that type of cell. It's not that our body's meant for this to happen. The locks on our cells aren't for viruses. They're for things our bodies naturally normally do. And viruses can't hack into every cell type, just the ones where their keys match the lock closely enough. But when a virus can get inside, it hijacks the machinery of the cell and uses it to make more copies of itself, including more copies of that false key. Those new virus copies with their false keys on the outside, they then break out of those infected cells and move on to infect new cells. And in many cases, the cell that's been infected and hijacked is destroyed in the process. As the virus starts hacking into more and more of our cells, the body recognizes that, there's an infection. The body then sends out an alarm to rev up the immune system so it can fight off the virus. And it's actually that activity of our immune system getting to work that makes us feel sick. That's where the fever, the chills, the cough, and other symptoms come from. Now, there are times when the immune system is fighting a virus, but a person doesn't feel sick. When this happens, that person can still spread virus, even though they don't know they're infected. And it's a big problem for infection control that we're going to talk about more in another video. So, what happens when you're infected with a respiratory virus, whether you know it or not, and you cough or breathe out or talk? Well, your droplets with virus in them are carried out, reaching other people, getting into their nose, mouth, throat, and lungs, and infecting them. And this whole process in the cell that we just talked about starts all over again. But we don't want that to happen. And that's why, as we talk about these things that we do for infection control, you'll see that many of them focus on keeping respiratory droplets out of the air and away from other people. As always, thanks for joining us. Please be sure to follow up with us on Facebook or Twitter, and check us out on the web at cdc.gov/Project Firstline. We'll see you back here for the next episode.
The key messages: how do viruses make you sick? Topic 2. Viruses use cells in living things, including people, to make copies of themselves. This is how viruses spread within a body and from person to person. Viruses that can make us sick have found a way to make a false key that will fit into a lock in our cells and then invade those cells. When enough viruses have been able to get into our cells and make copies of themselves, the body recognizes that there is an infection, and our immune system begins to fight it off and work to fight off the virus. As the virus hacks into more cells, the body recognizes there is an infection. It is the activity of our immune system fighting the virus that makes us feel sick. That is when we experience the fever, the cough, the chills, and other symptoms when we don't feel well. Next slide, please. The learning objectives for topic 2. Topic 2 is how respiratory droplets spread COVID-19. Describe one characteristic of respiratory droplets. Understand one primary way that SARS-CoV-2 moves between people, and explain one reason why infection control actions focus on keeping respiratory droplets out of the air and away from other people. Next slide. Dr. Carlson now will explain about respiratory droplets and why they matter.
Hello, everyone. I'm Abby Carlson. I'm an infectious diseases physician and a doctor here at the Centers for Disease Control and Prevention in Atlanta, Georgia. And today we're going to talk about a topic that you hear about a lot: respiratory droplets and how they spread COVID-19. Okay, we know that we want to keep from getting infected with the virus SARS-CoV-2 so that we don't get sick with the disease COVID-19. But how does the virus get from one person to another? The answer is actually different for every virus, but for SARS-CoV-2, the main way that the virus seems to travel between people is through something called respiratory droplets. But what are those? In this case, droplet doesn't just mean a water that you can see, like big raindrops or splashes in the sink or a pool. These droplets we're talking about are actually really tiny, and where they come from might surprise you. You might think that when you breathe out, all that comes out is air, right? You don't see anything else. But in fact, our breath contains a lot of water. And usually you can't see that water. But think about it for just a moment. When you go outside in cold weather and you breathe out, you see your breath. Or if you breathe on a mirror, it fogs up. Or this one actually happens to me all the time. When I'm in the hospital, I put on my mask and my glasses start fogging up. What you're seeing in all these cases is not air, it's all the water in your breath. Those are your respiratory droplets. So every time that we let out air when we breathe, whether we're talking or singing or just sitting here breathing, we also let out those little tiny respiratory droplets. I'll pause here for a moment and say that although all of these droplets are small, they aren't all the same size of small. Some you can actually see, like when you sneeze. Most of them, though, are sizes that we can't see. And different size droplets can travel different distances in the air. Some will go farther than others. The distance they travel also depends on other things like the air currents in the room or how strongly they were pushed out, like when you cough. We'll talk about these ideas more in another episode later on because this difference in sizes is very important for certain things we do in infection control. For now, though, it's important to know that even though these droplets come in a lot of different sizes, they're all small enough and light enough that if another person is close by and we aren't wearing our masks, say we're eating at a table or we're with a patient who doesn't have a mask on either, then that person can breathe in the droplets that we've just breathed out. And when someone is infected with SARS-CoV-2, those tiny respiratory droplets have virus particles inside of them. If you breathe in respiratory droplets, they're carrying that virus that can then get onto your nose and into your throat and your lungs. It sounds really gross, I know, but that's what happens. And they can also land on your eyes. And when those droplets land in all of those places, the virus lands on cells. Some cells they can't get into, they just don't have the way in. But like many other respiratory viruses, SARS-CoV-2 is able to get into a lot of cells in our nose, our throat, our eyes, and our lungs. And when that happens, the virus can then hijack the cells. And that's how we get sick with COVID-19. We'll talk more about how exactly viruses hijack cells in another episode, so be sure to stay tuned for that. Now, if the goal of infection control is to keep people from getting sick, and we know that respiratory droplets are the main way SARS-CoV-2 moves between people, then we know that the actions that we take for infection control and that we need in healthcare settings are things to keep people, ourselves and our patients, from breathing in each other's respiratory droplets. I know there are a lot more questions about this topic. We've covered respiratory droplets very quickly today, and we'll talk more about them in future episodes because there's a lot to cover. For the meantime, thank you all for joining us. As always, be sure to follow up on Facebook or Twitter and check us out on our website at cdc.gov/Project Firstline. We'll see you back for the next episode.
The key messages, as Dr. Carlson said, our breath contains a lot of water that you can't usually see. When we see our breath in the air or see our glasses fog up, when we're wearing a mask, what we're seeing is all of the water in our breath. Those are our respiratory droplets. The main way that SARS-CoV-2, the virus that causes the disease COVID-19, travels between people is through respiratory droplets. When someone is infected with SARS-CoV-2, the droplets that they breathe out have virus particles in them. People who are close by can breathe the droplets in, or the droplets can land on your eyes and then can be infected. This is why masking was so important during the height of COVID-19 because it was a way to decrease the spread of COVID-19. Some communities are beginning to institute masking again in anticipation of an increase of respiratory viruses during this virus season. Next slide, please. The learning objectives for topic 4, how viruses spread from surfaces to people. Describe 2 ways viruses can spread from surface to people. Explain one reason why good hand hygiene and environmental cleaning are especially important to keep germs from spreading in the healthcare environment. We will now listen to Dr. Carlson as she discusses how viruses spread from surfaces to people.
Okay, I'm going to stop sharing for a moment and then pull up that video. So thank you everyone for your patience. Mhm. Can we get a thumbs up if everyone can see this?
Yes, we can see it.
Thank you. Pressing play.
Hi, everyone. I'm Abby Carlson. I'm an infectious diseases doctor here at the Centers for Disease Control and Prevention in Atlanta, Georgia. And welcome back to our Project Firstline video series, Inside Infection Control. We've been talking in this series a lot about viruses, specifically SARS-CoV-2, the virus that causes COVID-19. We've also talked about how viruses work and how they spread. And today we're going to focus on that last part, how viruses and other germs that make us sick spread. We know that we get sick with COVID-19 when the virus SARS-CoV-2 gets into our nose, mouth, and eyes. But other than breathing it in, how else can the virus get to those places? Well, quite simply, on your hands. When you touch something that has live virus on it, and then you touch your face without cleaning your hands first, you can get virus into your eyes, your nose, and your mouth. And so then the question comes, what things have virus on them? Well, more than you might think. And to understand why, let's go back to those respiratory droplets. We talked in an earlier episode about how these droplets have a lot of different sizes. And when they're breathed out, some of the very tiny ones are going to be caught in the air and carried away, traveling wherever the air currents are going. But a lot of those droplets are big enough, still small, but big enough that they won't travel very far in the air. Instead, they'll start falling towards the ground. You can think of it a little bit like leaves on a tree. A lot of the leaves are going to fall near the tree, but some of them will be caught by the wind and they'll move with the direction of the wind. They'll fall a little further away. Let's take that image a step further. Leaves falling from a tree don't just fall to the ground either. They also fall on your car, the roof of your house, anything that's nearby. Just like that, droplets, respiratory droplets, they fall on things that are nearby, like patient beds and waiting room chairs, desks, clothes. The list is very long. Once the droplets land on something, the virus can survive for at least a little while. It's not long for most surfaces, but it's long enough for you to touch that surface and for the virus to make it onto your hands. From there, the virus can get into your body if you touch your face without cleaning your hands first. And that happens. You're exhausted at the end of your shift and you rub your eyes, or you're running from place to place and you forget to clean your hands. It's one of those habits that's just hard to recognize and hard to break. In addition to droplets falling down, another important way that virus can get onto surfaces is when an infected person touches their eyes, their nose, their mouth, which gets virus onto their hands, and then they touch another surface, like a break room door handle or the keyboard in the nurse's station, an elevator button, an IV pole. Again, this list goes on and on. And these actions, they leave the virus on that surface that someone else can pick up on their hands. And it's gross to say, but for any of us who have been in healthcare, we know that the body fluids that we have, including spit and snot, can get onto things like linens and things near a patient. And if anyone touches those surfaces and doesn't clean their hands, they can spread virus around that way, from themselves to other surfaces to other people. Knowing all of this, we can see why good hand hygiene and good cleaning of the environment are so important for infection control, so that viruses and other germs that make us sick don't spread. We're going to talk a lot more about this in other videos because it's a big topic that applies to many diseases, not just COVID-19. In the meantime, thank you for joining us. As always, please don't hesitate to follow up on Facebook or Twitter, or check us out online at cdc.gov/Project Firstline.
Okay. Yeah.
That's the slide. So, as Dr. Carlson said, just to review a couple definitions, fomite transmission is infection spread through direct contact with an article or a surface. For example, a stethoscope that has been contaminated with infectious material. Fomite is non-living objects contaminated with the microorganism that can spread the microorganism to other people. Contact transmission, on the other hand, is infection spread through direct contact with an infectious person. An example would be touching during a handshake, or taking, if a doctor or nurse or a healthcare worker are taking the pulse of someone, or with an article or a surface that has infectious material on it. The key messages. The key messages for topic 4. Although COVID-19 is mainly spread through respiratory droplets, another way you can get sick is if you touch something that has live virus on it, then touch your face without cleaning your hands. Viruses can get on surfaces when respiratory droplets land on them, and viruses can also get on surfaces when body fluids from an infected person gets onto things nearby. Always be careful in the healthcare environment when touching different surfaces, and remember to wash your hands after touching any of these surfaces, and also before you enter and work with the patient and once you exit. The main way, as we know, Dr. Carlson discussed that SARS-CoV-2, the virus that causes the disease COVID-19, travels between people is through respiratory droplets in our breath. Another way that you can get sick with COVID-19 is if you touch something that has live SARS-CoV-2 virus on it and then touch your face without cleaning your hands first. Next slide, please. Next, I would like to review just a couple slides. This first slide contains information about our Maryland Project Firstline website. On our website, we have many resources, and our website has several resources available to you to download on infection control principles and guidelines. Feel free to check out these resources to assist with updating your knowledge about infection control practices. And this information that we reviewed today is also available on our learning management system. Next slide, please. This slide, go back one. This slide is our learning management system. You can access it at MD Firstline LMS. And our learning management system contains all courses we offer, which are self-guided, as well as the topics we will be offering during our webinars. All 17 courses are available in English as well as Spanish, and our first 5 topics are also available in Russian, Chinese, Haitian Creole, and Tagalog. Check it out, and please join us for future monthly webinars. Please follow us on Facebook or X, or if you need to reach us, you can email us at mdfirstline.hqi.solutions. Finally, our last slide contains our QR code to complete our feedback form. You can scan the QR code and complete the feedback form for this training. Before I go into more information, I would like to ask, does anybody have any questions about the information that was presented today on infection control? Feel free to put a comment in the chat, or you are welcome to unmute yourself and ask the question live if you do have a question.
Diane, if it's okay with you, can we stop sharing the screen?
Yes, I can tell them about the feedback form
You.
and the link that you are going to provide in the chat. All right, so let me check the chat real quick. I don't see any questions, but again, feel free to put it in there. And let me finish and tell you about our feedback form. So our feedback form helps us. We hope that this information was helpful and useful to you. And it's something that you are welcome to share with any of your staff, environmental service or healthcare staff at your facilities or communities. Kendall will be placing a link to the feedback form in the chat for easy access. Just to let you know also about our incentive program. If you attend a training or you complete a topic and a feedback form for that topic, whether it is in person or whether it is online during a webinar, your name, once you complete the feedback form, will be entered into a random drawing. And we do one random drawing for our Learner of the Month each month to receive a $25 Walmart e-gift card while supplies last. You must be a healthcare worker or environmental service staff working in a healthcare setting in Maryland to qualify, and Maryland Department of Health or local health department workers are not eligible for this incentive. So we hope that you will provide us information that this topic was helpful and useful for you. I also want to let you know if you're interested in a training for any group in your healthcare facility. We do in-person trainings. We also do webinars. We can do a webinar just for your group, and we can schedule that online as well. And if you do go to our website or you send us an email, we can arrange for that. We also have an escape room training, which has been very popular this past year. And we have 4 topics that go along with that. And that also is an in-person training. So I would like to thank everyone for joining us today. I'll check the chat just one last time to see if there are any questions.
We do not at this time.
Okay, great. But if you do, feel free to send us an email. I know the information was very basic, and I know many of you have reviewed this over and over with your staff. But with the upcoming respiratory virus season, we thought it would be a good topic to review just for some of those reminders to make sure you have all of your guidelines in place. And thank you to all the healthcare workers. We truly appreciate your work, especially over these past couple years with COVID and the many respiratory viruses that we have been facing.
Thank you, Diane. I am going to get ready to wrap up today's event.
Okay.
As we conclude today's webinar, I want to thank our speaker, Diane, for putting together such an informative presentation to help us better understand and prepare for this respiratory season. We so appreciate your time and the care that you put into sharing this information with us today, so thank you. I want to extend my heartfelt gratitude to each of you and our audience for your presence. You make our work here so meaningful, so thank you. If you have any further questions or need any additional resources, please do not hesitate to reach out to myself at the EPN. Our email is linked in the chat. Additionally, the contact information for our speaker, Diane, she is graciously provided, can be found in the chat as well. Following today's presentation, you can look forward to receiving presentation materials, which will include a copy of the recording, a copy of the presentation slides, alongside with additional supportive resources just for you. So thank you so much again for joining us, and stay safe. And until next time, bye-bye, everyone.
Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.
Thank
You're
you.
welcome.